Seeing the health sector rise to the challenge brought by COVID and respond rapidly has created the expectation it will continue to change at pace. It's time to take a long, hard look at how we'll make that happen. Who could have predicted a disruption to our health system that will bring such widespread, fast-moving change? Accelerating the opening of hospitals under construction, introducing thermal cameras for temperature testing of people entering hospitals, allowing for pop-up COVID testing clinics, changing announcements on queuing systems in hospitals, back office staff working remotely and security systems to help them do that safely, the highly publicised rollout of telehealth nationally, and the real-time location services, RTLS, to new hospitals. If the health sector had adopted its traditional approach and legacy systems, it would have floundered. But the response to COVID was successful because it focused on the end user, the patient and the person, rather than the process. Instead of getting caught up in bureaucracy, there was a collaboration between government departments. There's a new understanding now in health, in the wake of COVID, that we need to be more personalised in our approach and find ways for customers to share data from smart wearable devices like Garmin's or Apple Watches so that people can stay out of hospitals, providing insights into their condition from home. Leaders now believe in the value of a data lake created out of disparate apps in the health system to give us better insights into a whole range of things. They understand it needs to be accelerated and that money and resources need to be invested. There's an understanding that we need to better connect local health districts so that people can move around between hospitals and locations. Patients need to have easier access to insights into their own health and trust in the secure management of these insights. So what are the new imperatives? First, it's throwing out the traditional approaches, like sweating outdated assets and adhering to slow and expensive procurement processes. Not being fixated on the old model of owning everything. We need to see everything as a service, as a way to rapidly scale up and potentially then scale down in the future post-COVID if the capacity is no longer needed. We need to understand the wider applications of RTLS as a potential productivity gain and benefits to facial recognition for security and access control. Take advantage of technology hospitals already have and leverage Wi-Fi infrastructure as a highway to roll out apps and link up messaging systems in hospitals together into one control panel. CCTV, medical equipment, visitor management systems, security systems, maintenance, mobile GRS, real-time location tracking, telephony, mobile communications, contact center applications, hand hygiene, all tied into Wi-Fi. Providing the health workforce with systems and tools that are adaptable and can quickly scale to new demands, including work from home, increased use of video conferencing and integration of teams. To move to these imperatives requires trust in partners. Health organisations need to put their trust in technology providers who understand their operations and can deliver innovative solutions quickly. Where NEC is helping now is in providing an understanding of apps, IoT, and connective devices, cloud connectivity, and being able to tie it all together. Also supplying screens in hospitals for SurgiNet, Journey boards, and IPTV, running on the networks, linking back into patient entertainment systems. Working together, we're being agile and innovative to improve health solutions. Working towards greater security for staff and patients, and greater productivity for staff and clinicians.